Good morning, doctors. Welcome again. Today we are going to discuss about UPSC 2002 year paper, and this is a part 2, and we are going to discuss A of section 30 MCQs nearly here. Which of the following fetal diameter measures 9.4 centimeter at term? That is biparietal diameter nearly 9.5 centimeter. First one in option right, and submantobigrammatic diameter. So first and third is the answer. So B option is a right here. Let's see. Yes, B is a right here. And 9.5 diameter is 3 submantobigrammatic and biparietal diameter and suboccipitogrammatic. Okay. Now, a multiparous woman delivered by a village Thai midwife present on a 22nd postnatal day with bleeding per vaginum with clots. On examination, the uterus is 14 to 16 weeks, the internal os is open, and there is a bleeding through the os. What is the likely cause of this bleeding? So, answer here is retained bits of placenta and membranes. So, C option is a right. This is a case of wrong management of labor. In such cases, often retained bits of placenta and membranes present with the which leads to postpartum bleeding. It is very common problem in India. Okay. The incidence of congenital fetal anomalies is highest when pregnancy is complicated by. It is mainly due to the hydroamnios detectable on clinical examination. A option is the right. Yes. So the incidence of congenital fetal malformation is 20% in hydroamnios. Okay. Now, a Paris woman notices a bulge at a vulva that diminishes in size, which following micturition, she also finds it difficult to initiate micturition. What is the likely diagnosis? So this is a case of cystocele. C. Yeah. Now, a 30-year-old woman present with 3 months amenorrhea, pain abdomen for last 2 days and fainting attacks of the last 8 hours. On examination, her pulse rate is 102 beats per minute. The systolic blood pressure is 90 and she has 1 plus pallor. On abdominal palpation, she has tenderness. She is previously diagnosed with ectopic pregnancy. The most likely site of implantation within the fallopian tube is in ampullary region of the tube. So A option is the right. Yeah. Now, a 18-year-old girl present with primary amenorrhea and gives a history of cyclical colicky abdominal pain. The most probable diagnosis here is hematocolapse. So D option is the right. This is explanation here. Now, a 20-year-old married woman anxious to get pregnant has cyclical cramps and sharp lower abdominal pain which last for 3 days starting from the day of menstrual flow. The menstrual periods are regular but heavy. On examination, her pelvis is normal. The most probable diagnosis is this is a case of primary dysmenorrhea. C option is the right. The patient is suffering from primary dysmenorrhea. It is defined as recurrent crampy pain occurring with menses in absence of identifiable pelvic pathology. And secondary menorrhea, dysmenorrhea is menstrual pain associated with underlying pelvic pathology such as endometriosis. So hope it's clear. Which of the following statement regarding functional epimenorrhea is not correct? It is cyclical bleeding. Yes. The cycle is reduced to an arbitrary limit of 21 days or less. Yes. It is seen more frequently at the end of reproductive life. Yes. If epimenorrhea is associated with heavy menstrual loss, it is called menometrorrhagia. So this is false. D option is the right answer here. In a patient of dysfunctional uterine bleeding with cyclical menorrhagia, the first line drug here is tranexamic acid. A option is a right. Now, the pelvic examination of a woman reveals that the cervix is directed forwards, the body is backward, but it can be anteposed easily. The examination does not demonstrate any abnormality. The most probable diagnosis is retroverted uterus. The option is right. A 20-year-old woman who has delivered 2 months ago at home by a nurse presents with complaint of something protruding through the vulva. The clinical examination reveals a cystocele, rectocele, and cervix 1 centimeter above the introitus. The most probable appropriate management will be go for syringe operation. The option is the right. Let's discuss. The patient present only after 2 months of delivery. Ideally, no operative treatment should be carried out. So early until and unless it is hampering the life of a patient of a great extent, the patient should be advised the pelvic exercise and followed up for definitive treatment if required 6 months after delivery. Okay. Consider the following are the feature of backache due to a genital prolapse. Correct statement we have to find. Pain is experienced on getting up in the morning? No. Patient complained of diffuse pain over the sacrum? Yes. There is no local tenderness? True. The pain occurs more commonly among multiparous than nulliparous. Second, third, and fourth is right. D option is right here. Yeah. Now, a woman who is being investigated for infertility is diagnosed to have nulliparous prolapse in uterus. The most appropriate management will be syringe operation. See, yeah. Which of the following is not an outcome of gonococcal salpingitis? That is, salpingitis is nica nodosa. C option is right. A Paris woman complains of itching in the vulva. Examination, there is a local tenderness and swelling and white flecks around the introitus. The most probable diagnosis is candidiasis. C option is right. A recently married woman present with dysuria, increased urinary frequency of 2 days duration. On physical examination, her body temperature is 38 degrees Celsius and her vital signs are normal. Her gynecological examination does not reveal any vaginal discharge, vaginitis, or cervicitis. Her urine analysis reveals 14 WBCs per high power field and many gram negative roads. Which of the following is the most appropriate pharmacotherapy? Go for ampicillin here. So this is the answer, correct? Yeah. A characteristic feature of inguinal lymph node associated with primary syphilitic lesion on the vulval area. So the answer here is firm, shorty, painless nodes that do not suppurate. So B option is right here. Now, the common manifestation of genital tuberculosis includes the following except it does not include the foul smelling vaginal discharge. B option is right. Now, a 60-year-old woman is diagnosed with genital malignancy. On examination, physical examination, she is found to have the enlargement of superficial inguinal lymph nodes. The most likely organ involved is vulva. Yeah. So, the drug which may interfere with the efficacy of oral contraceptives and increase the failure rates are all of the following except answer here is sulfonamides. D. Now, consider the following statement: diets high in vitamin C have been claimed to lower incidence of certain cancers, particularly esophageal and gastric cancer. So answer is first only. Now, iron is absorbed predominantly in jejunum, also in duodenum, but jejunum is also answer. So B is right. Biological value of given protein depends on amino acid composition alone. C option is right. Now, The most common opportunistic infection observed in a patient with HIV/AIDS is pneumocystis carinii D. Now, what is the recommendation for the use of levonorgestrel for the purpose of emergency contraceptive is none of the above, because 0.75 mg levonorgestrel we have to use two tablets within 120 hours. Okay. Which of the following vitamins given as a supplement during the preconceptional period of woman can help to prevent the neural tube defects in a baby? That is folic acid. D option is the right. Now list match the following. Thymine is for C. Niacin is responsible for dermatitis. Niacin B का option आएगा first. So two options in front of you are B is first. So D we see, and retinol is butyrate sport. C is 2. Cholecalciferol is triradiate pelvis, and thymine is for cardiac failure. Cardiac failure. So D option is the right here. Yes, D is the right. Now, which of the following condition may produce the wrist drop, that is lead poisoning? Now, the most common hospital acquired nosocomial infection is UTI, urinary tract infection. A option is the right. Yeah, A is the right. Now, match the list first and second and select the correct answer using the code below. Carter thermometer for low air velocity, A का 4. Globe thermometer is for mean radiant temperature, B का first. And C anemometer for high air velocity, and Selene psychometer for relative humidity. So answer here is A. So guys, I hope it's clear for you till here, and have a good day. Goodbye. That's all for today. With more new parts I will bring soon, and please practice this. If you have any queries, any question, you can ask me, because I already written here explanation. Have a good day and goodbye.